All right, hello, Mr. Wallace. My name is Stacy. I'm gonna be your nurse for today. I'm gonna go ahead and shut this door for some privacy. All right, I'm gonna be doing your head to toe assessment today. I'm gonna start by going ahead and washing my hands for proper hygiene. All right, what I want to do first is I'm going to go ahead and inspect your head. I'm just going to make sure your eyes are in the certain, like the correct places. Make sure there's right symmetry, as well as your ears. Your skin is the brown, it's right color for your skin tone. Your skin seems to be intact. Everything looks normal. I don't see any abnormal findings. All right, so now what I'm going to do is I'm going to slide on some gloves, and I am going to check your cranial nerve 7. So if you don't mind doing me a favor, close your eyes tightly. All right, open them back up for me. Smile, frown, and then also puff out your cheeks for me. All right, you can let them go. All right, slap my gloves on. Again, like I said, I'm gonna check your scalp just to make sure there's no mass or anything like that. Let me know if there's any tenderness, any pain anywhere. Any pain, any tenderness?
No.
All right. So that seems to be okay. Nothing hurts, you're not in any kind of pain, so I don't see anything abnormal there. I'm gonna slide my gloves off. I'm gonna wash my hands. All right. Also, now what I'm gonna do is check your cranial nerve 5. So I'm just gonna feel on your face, do me a favor, clench down on your teeth. All right, I'm gonna check your temporal muscle. Open your mouth for me, please. All right, shut it. I'm gonna have you open it one more time. Checking for against resistance, you can shut it. All right, I was just feeling for the TMJ joint. Also, open your mouth for me. I'm going to use my tongue depressor, just looking for any kind of lesions or anything in the mouth. Make sure that's pink. Stick out your tongue. Ah. All right, I'm going to see any lesions. I can see a uvula. All right, lift your tongue up for me. All right, you can shut your mouth for me. All right, I'm going to check your sinuses, your maxillary. Any pain, any tenderness, temporal, any pain, any tenderness. All right, so I'm going to inspect your eyes. I'm just going to check for any swelling, anything like that. Your sclera looks white, looks good. I'm just going to pull down on your eye just to check your conjunctivi. And it looks white, that looks good. All right, look straight ahead for me, please. Just make sure I don't see any shakiness, anything abnormal. All right, that looks good. What I'm gonna do now, I'm gonna hold out my pen light toward 14 inches. Just wanna make sure there's no shakiness, anything like that. That looks good. Now I'm gonna dim the light. All right, I'm gonna use my pen light. Just look straight ahead for me, please. Just look off into the distance. All right, I'm gonna turn the light back on. I was just checking for Paula, and what that is pupil equal react, round react, light accommodation. So your pupils did react to the light, so that's fine, no abnormal findings. All right, I'm just going to inspect your ears. I'm gonna pull up on the helix. Let me know if there's any pain, any tenderness, any pain, any tenderness.
No.
All right, I'm gonna push on the tibula. Any pain? Any tenderness?
No.
All right. All right. I'm going to be using my otoscope to look inside your ear to look at the temporal membrane. It should be a grayish looking color. If everything is fine, everything is normal. Now, if there's any reddish or any fluid in your ear, that could possibly mean that you could have an infection, but everything looks good to me. All right, I'm just going to check your nose, make sure that it's equally in the middle of your face. All right, what I need you to do is hold down one nostril. You're gonna blow out, and then you're gonna do the same to the other one. All right, everything sounds good. Doesn't sound anything abnormal. I'm just gonna check in your nose just to make sure there's no lesions, no polyps, no redness, anything like that, okay? All right, I didn't see any drainage, anything like that, so that looks fine. All right, close your eyes for me. This is vanilla. We're gonna act like it is. Go ahead and sniff up for me. What do you smell?
Vanilla.
All right, you can go ahead and open your eyes for me. Hold out your tongue for me, and you're gonna side to side. All right, everything looks good. All right, that was checking your cranial nerve 12. All right. Now, checking your cranial nerve 10, which I already did because you can swallow. Go ahead and swallow for me, and you're able to respond to my questions without any hesitations or any problems. You talk and you speak well. So what I want to do now is check your trachea. I'm just going to palpate the area. Seems to be in the correct place. Line symmetry is equally proportionate. All right, to check your cranial nerve 11, I'm gonna have you sit at a 45-degree angle and tilt your head side to side. All right, push up your shoulders from resistance. All right, you can let it go. Now I'm going to check your artery in your neck. All right, find a good 2+. Same on that side as well. Then I'm just going to check for it with the back of my bell. All right, that sounds normal. It's just a little swish sound on both sides. All right, Mr. Wiles, did you have any questions for me? Anything? All right, I'm gonna wash my hands and I'm going to get out of here. Thank you so much. Okay.